62. Soft tissue sarcomas and lymphomas. Soft tissue sarcomas. What are they?
Soft tissue tumors derived from mesoderm.
Sarcoma means what in Greek?
Fish flesh.
Sarcomas are more common in upper or lower extremities.
50% of sarcomas are in the extremities and are 3.5 times more common in the lower extremity, the thigh.
How common are they?
They comprise 0.6% of malignant tumors.
What is the median age at diagnosis?
55.
What are the risk factors?
Rails, R-A-L-E-S. R, radiation. A, AIDS, immunosuppression. L, lymphedema. E, exposure to chemicals. S, syndromes. For example, Gardner's Lymphoma. Rails, R-A-L-E-S.
Name the following types of malignant sarcoma. Fat,
Liposarcoma.
smooth muscle,
Leiomyosarcoma.
myofibroblast,
Malignant fibrous histiocytoma.
striated muscle,
Rhabdomyosarcoma.
vascular endothelium,
Angiosarcoma.
fibroblast,
Fibrosarcoma.
lymph vessel,
Lymphangiosarcoma.
peripheral nerve,
Malignant neurolymphoma or schwannoma.
AIDS,
Kaposi's sarcoma.
lymphedema.
Lymphangiosarcoma.
What are the signs, symptoms?
Soft tissue mass. Pain from compression of adjacent structures, often noticed after minor trauma to area of mass.
How do most sarcomas metastasize?
Hematogenously. In other words, via blood.
What is the most common location and route of metastasis?
Lungs via hematogenous route.
What tests should be done in the preoperative workup?
Chest X-ray, possibly chest CT, LFTs.
What are the 3 most common malignant sarcomas in adults?
Fibrous histiocytoma, 25%, liposarcoma, 20%, leiomyosarcoma, 15%.
What are the 2 most common in children?
Rhabdomyosarcoma, about 50%, fibrosarcoma, 20%.
What is the most common type to metastasize to the lymph nodes?
Malignant fibrous histiocytoma.
What is the most common sarcoma of the retroperitoneum?
Liposarcoma,
How do sarcomas locally invade?
usually along anatomic planes, such as fascia, vessels, etc.
How is the diagnosis made?
Imaging workup. MRI is superior to CT at distinguishing the tumor from adjacent structures. Mass less than 3 centimeters, excisional biopsy. Mass more than 3 centimeters, incisional biopsy or core biopsy.
Define excisional biopsy.
Biopsy by removing the entire mass.
Define incisional biopsy.
Biopsy by removing a piece of the mass.
What is the orientation of incision for incisional biopsy of a suspected extremity sarcoma?
Longitudinal, not transverse, so that the incision can be incorporated in a future resection if biopsy for sarcoma is positive.
Define core biopsy.
A large bore needle that takes a core of tissue, like an earth core sample.
Define the following American Joint Committee for Cancer Staging, AJCC, sarcoma stages. Stage 1.
Well differentiated, grade, any size, no nodes, no metastases.
Stage 2.
Moderately differentiated, grade, any size, no nodes, no metastases.
Stage 3.
Poorly differentiated or undifferentiated, grade, any size tumor, no nodes, no metastases.
Stage 4.
Positive nodes or distant metastases.
What is a pseudocapsule and what is its importance?
It is the outer layer of a sarcoma that represents compressed malignant cells. Microscopic extensions of tumor cells invade through the pseudocapsule into adjacent structures. Thus, definitive therapy must include a wide margin of resection to account for this phenomenon and not just be shelled out like a benign growth.
What is the most important factor in the prognosis?
Histologic grade of the primary lesion.
What is the treatment?
Surgical resection and radiation, with or without chemotherapy.
What surgical margins are obtained?
2 centimeters.
What is the limb-sparing surgery for extremity sarcoma?
Avoidance of amputation with local resection and chemoradiation.
What is the treatment of pulmonary metastasis?
Surgical resection for isolated lesions.
What tests should be done in the follow-up?
Physical examination, chest x-ray, repeat CT, MRI of the area of resection to look for recurrence.
What syndrome of lymphangiosarcoma arises in chronic lymphedema after axillary dissection for breast cancer?
Stewart-Treves syndrome.
What syndrome is associated with breast cancer and soft tissue sarcoma?
Lee-Fraumeni syndrome. P53 tumor suppressor gene mutation.
Lymphoma. How is the diagnosis made?
Cervical or axillary node excisional biopsy.
What cell type is associated with the histology of Hodgkin's disease?
Reed-Sternberg cells.
What are the 4 histopathologic types of Hodgkin's disease?
1. Nodular sclerosing, most common, about 50% of cases. 2. Mixed cellularity. 3. Lymphocyte predominant, best prognosis. 4. Lymphocyte depleted.
What are the indications for a staging laparotomy in Hodgkin's disease?
Controversial. Rarely performed for the low stages because they are treated differently than advanced stages. Most experts rely on CT scans and do not perform laparotomy.
What is a staging laparotomy for Hodgkin's lymphoma?
A laparotomy to distinguish between advanced and low-stage disease to define proper therapy. It includes 1. Splenectomy, 2. Iliac crest bone aspiration, 3. Biopsies of splenic hilar, celiac, mesenteric, portahepatis, para-aortic, and iliac lymph nodes, 4. Liver biopsy, 5. Oophoropexy. If the patient is a woman of childbearing years, the ovaries are marked with metallic clips and then tacked behind the uterus for protection from the radiation field.
Define the stages, Ann Arbor, of Hodgkin's disease. Stage 1.
Single lymph node region. Think stage 1 equals 1 region.
Stage 2.
2 or more lymph node regions on the same side of the diaphragm. Think stage 2 equals more than 2 regions.
Stage 3.
Involvement on both sides of the diaphragm.
Stage 4.
Diffuse and/or disseminated involvement.
What is stage A Hodgkin's?
Asymptomatic. Think A asymptomatic equals stage A.
What is stage B Hodgkin's?
Symptomatic, weight loss, fever, night sweats, etc. Think stage B equals B bad.
What is the E on the staging?
Extralymphatic site involvement. E equals E extralymphatic.
What treatments are used for low versus advanced stage Hodgkin's lymphoma?
Low stage, radiotherapy. Advanced stage, chemotherapy.
What percentage of patients with Hodgkin's disease can be cured?
Approximately 80%.
GI lymphoma. What is it?
Non-Hodgkin's lymphoma arising in the GI tract.
What is the risk factor for gastric lymphoma?
H. pylori.
What are the signs, symptoms?
Abdominal pain, obstruction, GI hemorrhage, GI tract perforation, fatigue.
What is the treatment for gastric lymphoma?
Controversial. Chemoradiation versus surgical resection.
What is the treatment of intestinal lymphoma?
Surgical resection with removal of draining lymph nodes and chemotherapy.
What is the most common site of primary GI tract lymphoma?
The stomach, 66%.